Two pills. Both kill pain. But they are not the same drug. One is stronger, one is safer. And choosing the wrong one, or using either one the wrong way, can seriously hurt you. Today we are going to talk about Tramadol and Oxycodone. These are two of the most commonly prescribed painkillers in the entire world. Millions of people take one of these drugs every single day, but most of them have no idea how different these two medicines actually are. By the end of this video, you are going to know exactly how each drug works, how strong they are compared to each other, what side effects you need to watch out for, how dangerous they really are, and most importantly, which one is actually better and for what type of pain. So let's get into it. Let's start from the beginning. What exactly are we dealing with here? Tramadol is a synthetic opioid. That means it is completely man-made in a laboratory. It has been in medical use since the 1970s, so it is not a new drug by any means. What makes Tramadol special and different from other opioids is the way it works in your body. It does two things at the same time. First, it attaches to the opioid receptors in your brain and spinal cord, which is what reduces your feeling of pain. Second, and this is the part most people don't know, it also blocks the reuptake of serotonin and norepinephrine. These are chemicals in your brain that affect your mood and how you feel. Because Tramadol does both of these things, it works differently than most other opioids, and that double action is also why it comes with some unique dangers that we'll talk about later. Doctors usually prescribe Tramadol for moderate pain. Things like arthritis pain, fibromyalgia, chronic back pain, or recovery from a minor surgery. You might have heard of it under brand names like Ultram or Conzip. Same drug, different label. Now let's talk about oxycodone. Oxycodone is a semi-synthetic opioid. That means it starts from a natural source. Specifically, it is derived from an alkaloid called thebaine, which comes from the opium poppy plant. Then it is chemically modified in a lab. Unlike Tramadol, oxycodone works in one focused way. It binds powerfully to the opioid receptors in your brain and spinal cord and directly changes how your body processes and responds to pain signals. There is no serotonin action, no norepinephrine trick. It goes straight to the opioid pathway and hits hard. Because of this, oxycodone is reserved for serious, severe pain. We are talking about cancer pain, recovery from major surgery, severe traumatic injuries, the kind of pain where other medications have already failed. You have probably heard its brand names: OxyContin, Percocet, Roxicodone. These are all just oxycodone, sometimes mixed with acetaminophen, sometimes not, but the core molecule is the same. This is where most people get a real shock, because these two drugs are not even close in terms of strength. Oxycodone is approximately 1.5 times more potent than morphine. Now, most people use morphine as the standard reference point for measuring opioid strength. So being stronger than morphine already puts oxycodone in a very powerful category. Tramadol, on the other hand, is only about 10% as potent as morphine. That means Tramadol is a fraction of the strength of morphine, while oxycodone is stronger than morphine. When you put them side by side, Tramadol is roughly 1/8 as potent as oxycodone. So if oxycodone is a sledgehammer, Tramadol is a rubber mallet. They are not in the same league when it comes to raw strength. Speed matters, too. Tramadol takes about 1 full hour to start working after you take it. Oxycodone kicks in within 10 to 30 minutes. So oxycodone is faster, stronger, and more direct. Now you might be thinking, well, oxycodone sounds better then. And for the right type of pain, yes, it absolutely is. But stronger and faster does not always mean better or safer. In fact, it often means the exact opposite. Let's explore that. This is the question most people come here to answer. And the honest truth is that there is no single answer. It completely depends on what kind of pain you are dealing with. Tramadol works very well for chronic, moderate pain. If you have osteoarthritis, if you deal with daily back pain, if you have fibromyalgia, Tramadol can genuinely make your life more manageable. But if you have just been in a serious car accident, or you are waking up from a major surgery where they opened your chest, Tramadol is not going to cut it. It is simply not strong enough for that level of pain. Oxycodone, by contrast, is designed exactly for that severe acute pain. It is the drug that can bring a patient back from a level 10 pain situation to something survivable. But here is something really interesting that came out of clinical research. A study done on patients recovering from ACL knee surgery found that Tramadol alone actually produced lower average pain scores in the first 3 days after surgery compared to oxycodone, and with a better side effect profile too. So for certain types of post-surgical recovery, Tramadol actually outperformed the stronger drug. Another randomized trial done in older adults compared both drugs for acute locomotor pain, which is pain related to movement and joints. Both drugs reduced pain scores significantly within 2 days. But the Tramadol group had more nausea and a noticeably higher risk of falls and confusion, which is especially dangerous for older patients. So even when Tramadol works for the pain, it sometimes brings its own set of problems. The takeaway here is simple. Match the drug to the pain. Use Tramadol for moderate, manageable pain. Use oxycodone for severe pain that nothing else can handle. And never swap one for the other without telling your doctor first. Both Tramadol and oxycodone share a core group of side effects that come with most opioids. You can expect nausea, especially when you first start taking them. Constipation is almost guaranteed with both. Dizziness, drowsiness, dry mouth, and headaches are also common. These are the standard opioid side effects, and neither drug gets a pass on them. But here is where they separate from each other in important ways. Tramadol has 2 unique dangers that oxycodone does not share. The first is seizures. Tramadol carries a significantly higher risk of causing seizures compared to other opioids, and this risk goes up sharply in people who already have a history of epilepsy or seizure disorders. If you or someone you know has ever had a seizure, Tramadol should be approached with extreme caution and only used under very close medical supervision. The second unique danger of Tramadol is serotonin syndrome. Because Tramadol affects serotonin levels in the brain, it can cause a dangerous overload of serotonin if it is taken alongside other medications that also increase serotonin. This includes antidepressants like sertraline, fluoxetine, and others in the SSRI and SNRI category. Serotonin syndrome is a serious medical emergency. The symptoms include a racing heart rate, high fever, muscle twitching or rigidity, severe agitation, and confusion. It can become life-threatening quickly. This is something that many people who are on antidepressants simply do not know, that combining their medication with Tramadol can trigger this dangerous reaction. Oxycodone's unique and most dangerous side effect is respiratory depression. This means your breathing slows down. In mild cases, you might just breathe a little slower and feel very drowsy. In severe cases, your breathing can slow down so much that it stops completely. This is how the majority of opioid overdose deaths happen. And the risk of respiratory depression with oxycodone skyrockets when it is mixed with other substances, particularly alcohol and benzodiazepines like Xanax or Valium. These combinations are responsible for an enormous number of accidental opioid overdose deaths every year. Both drugs carry real dangers. The key is knowing which danger applies to your specific situation. Now we have to talk about the part that is hardest to hear, because it is the most important part of this entire conversation. Both of these drugs can trap you. This is not an exaggeration, and it is not a scare tactic. It is a documented medical reality. Out of the millions of Americans currently living with opioid use disorder, the vast majority started with a legally prescribed painkiller, exactly like Tramadol or oxycodone. The prescription that was meant to help them recover became the thing that changed their lives forever. Oxycodone is the more dangerous of the two when it comes to addiction. It is stronger, it hits the opioid receptors harder, and it produces a more intense feeling of relief and sometimes euphoria, which is exactly what makes it so habit-forming. Physical dependence on oxycodone can develop within just a few days of regular use. A few days. That is not weeks or months. That is how quickly your body can start to rely on the drug just to feel normal. And when someone tries to stop, the withdrawal symptoms, body aches, sweating, anxiety, insomnia, and intense cravings can be overwhelming. Oxycodone is also one of the leading opioids contributing to overdose deaths in the United States, sitting behind only heroin and fentanyl in that grim ranking. Now, people often assume that tramadol is the safe option because it is weaker and more commonly prescribed. But here is a fact that changes that assumption completely. A major study published by the Mayo Clinic found that patients who were prescribed tramadol after surgery were just as likely as those given oxycodone to still be using opioids long after their pain should have been resolved. The habit formed. The dependency grew, just more quietly. Tramadol does have a lower addiction profile in general, but it is still an opioid, and it still carries a real risk of dependence, especially with long-term use. Neither of these drugs is safe forever. Both of them demand respect, careful monitoring, and a plan to eventually stop using them. The way governments classify and control these drugs tells you everything about how seriously their risks are taken. In the United States, oxycodone is classified as a Schedule II controlled substance. Schedule II is the most tightly controlled category for drugs that are still accepted for medical use. It sits just below substances like heroin that have no accepted medical use at all. What that means in practice is that oxycodone prescriptions cannot be refilled, not even once. Every single time a patient needs more, their doctor must write a brand new prescription. There are no exceptions. Tramadol, on the other hand, is classified as Schedule IV, a significantly lower level of control. Tramadol prescriptions can be refilled up to 5 times within a 6-month period. This difference in scheduling is not arbitrary. It reflects decades of data showing how much more dangerous and abuse-prone oxycodone is compared to tramadol. So which one is better? Let's be direct. For moderate pain, tramadol is the smarter choice. It is gentler on the body, carries a lower risk of addiction, and is effective enough for the vast majority of common chronic pain conditions. For severe pain, oxycodone works better, full stop. It hits harder, it works faster, and for serious acute pain, there is often nothing else that will do the job. But oxycodone must be used with far more caution for the shortest time possible and under close medical supervision. Here is what both drugs have in common, though. Neither one should be used longer than necessary. Neither one should ever be taken with alcohol. Neither one should be mixed with other medications without your doctor's full knowledge. And neither one should ever be used based on what someone else told you worked for them. The best painkiller is not tramadol. The best painkiller is not oxycodone. The best painkiller is the right drug at the right dose for the right amount of time, prescribed by a doctor who knows your full medical history and has made that decision specifically for you. That is the only answer that actually keeps you safe. Before you go, a quick and important reminder. Everything in this video is for educational purposes only. This is not medical advice. Do not start, stop, or change any medication based on what you heard here. Both of these drugs are powerful, both carry real risks, and both can cause serious harm if used incorrectly. If you or someone you know is struggling with opioid dependence, please speak to a healthcare provider. Help is available and recovery is possible. If this video helped you understand these medications better, share it. Someone you know might be about to make a decision about one of these drugs without having the full picture. And if you want more clear, honest, no-nonsense health content just like this, subscribe. We will see you in the next one. Take care of yourself.